Good morning. So for this week's journal, we're supposed to talk about a new experience or significant event or interaction that happened in clinical this week. I can't say that there was in particular a new diagnosis, as the majority of the patients that my preceptor sees are children, a lot of them with ADHD, oppositional defiant disorder, and anxiety, depression, things like that, which is all things I'm pretty familiar with just from my previous clinical experiences and then just in general as a nurse. However, the new or challenging or significant experiences that kind of stand out to me and did happen this week in clinical is that when students or children who come in and are adolescents kind of in that 12 to 18 age range, and they start to exhibit signs of bipolar and they've been diagnosed as ADHD. Now sometimes that can get a little tricky because technically it's not a diagnosis for that age, and you do want to be careful with that diagnosis and make sure that you're accurately describing it or diagnosing it. But that was interesting for me in just seeing how that was handled, because this patient in particular probably had some clear signs of mania in that just waking up and staying up for extended periods of time, some hypersexuality, and just clear-cut classic signs of bipolar, and just her approach to that. I do think when you start to question those things or you start to see those things kind of arising, the preceptor that I use likes to describe it as we're working with a puzzle, and it's like at the beginning when they're children, and then you start to put the puzzle pieces in, and then you start to see the clearer picture of what the puzzle is pointing to, but you can't, but you're not finished. You can't accurately say, oh yes, this is definitely a bipolar diagnosis just due to age, but Lamictal or other mood stabilizers can be effective in cases like that, and that is the route that she went, and kind of how she chose to manage that. As far as how it went in increasing my understanding in the role of the psychiatric mental health nurse practitioner, again, I think it's important to understand that diagnoses are sometimes fluid. They're not always clear-cut, and sometimes they have a tendency, as you get to know the patient and see the patient, things evolve over time. So I think that that was an important thing to realize and to know going forward. So that was what was significant for me this week. Thank you. Bye-bye.